All right, let's talk about this. Every year, about 15 million people, including teenagers, become infected with HPV or human papillomavirus. Many parents and teens have heard of HPV, but they may not know the serious risks associated with the infection and the importance of getting an HPV vaccine.
Today, our mid-morning pediatrician, Dr. Gigi Chawla from Children's Minnesota, is here to talk about the vaccine, how it works, and why all preteens should get it. Good morning.
Good morning. Thanks for having me today.
Yeah, and this topic, I think, has been, it's a newer vaccine in the way that, you know, I don't think that our parents necessarily dealt with anything like this.
Right.
But it's a great thing to get.
Oh my gosh. So this is my favorite vaccine, actually. You know,
wow.
and all the vaccines are my favorite, but this one is really my favorite vaccine because this is a vaccine that prevents cancer.
Yeah.
And how can we not get behind that for our kids?
Let's start with HPV. What is it? What is it?
Yep, HPV stands for human papillomavirus. It's really a series of many viruses, all, you know, with different, slightly different permutations. And the vaccine offers a conglomerate of a few of these vaccine types in one syringe that will help protect us against the vaccine virus subtypes that are most predominantly affecting people with cancer.
And what type of cancer are we talking about that's possible?
Yeah, we're talking about vulva cancer, cervical cancer, you know, vaginal cancers, penile cancers. So not, you know, great topics that people want to talk about, but oh my gosh.
You don't want these cancers.
Absolutely.
And if you can prevent
it
with a vaccine, the data on this is pretty clear, right?
The data is profound. More than 90% of cases of cancer are prevented from this vaccine. So really thinking about getting this vaccine early so that...
How early? What age are we talking about?
Yeah, so it's licensed from age 9 to 26.
Okay.
And so we really target kids right around the time that we're starting to talk about puberty. So right around age 11 and 12 when we're giving other vaccines anyway, we just roll this one right in. So it's an easy way to get it done with parents still offering that guidance rather than having their teenagers choose or not choose it later.
Do you see pushback from parents, though, saying, well, you know, my child isn't going to be promiscuous?
Yeah.
You know, kind of fighting back in that way at all?
Yeah, you know, I think parents have a hard time kind of understanding how does this fit into the spectrum of their sexuality, and we really try to take it out of that and say, this is about cancer prevention. It's not about giving your child a license to be more promiscuous or saying in any way that they are or anything like that. This really is all about just preventing cancer.
Some parents just really don't want to talk about the side of the HPV. That is, it's a sexually transmitted, it can be a sexually transmitted virus, right?
Exactly.
So that's maybe the pushback. But this vaccine is for boys and girls. Right?
It is for boys and girls. And so really thinking about how can you position yourself to offer the best treatments for your child, including cancer prevention.
I'll tell you, like, I have kids right in this age range, right? And as a parent, like, you don't need to talk to your kid about, like, hey, this vaccine does this to prevent HPV if you're sexual. Like, you can just say this prevents cancer.
Yeah, this prevents cancer. And actually,
I don't know, we didn't have that full conversation about it. We said you're getting the vaccine, and that was that.
Are there any risks that are associated with it?
Well, I think any vaccine, you know, there's a small potential, like any vaccine, that somebody would develop an allergy to the component. Sure. But the biggest concern that most teenagers have is all teenagers, when they have vaccines, they have a potential for fainting. And so we always try to make sure kids are sitting and really spend some time here in the clinic afterwards. But, you know, the ads for HPV vaccine have done us a great service at really positioning kids to offer that guilt trip to their
It's about
families.
cancer. It's about preventing cancer.
Prevention.
Very good. Dr. Gigi, thank you.
Yeah, thanks for having me.